Hi friends, thank you so much for always coming in. This is Moving Wheels 26. I want to wish you happy holidays. I know guys are really enjoying, and you know, there is something, you know, people are going to be feasting, eating here and there, and you need to eat healthy. So please remember to eat healthy. And today I have a friend who is dealing with matters to do with health, and I've been able to receive some of the services, and that's why I felt it's very good for us to have a talk so that she can be able to talk to us more about the health issues, how we need to take care of our bodies and such kind of things. And so she'll be introducing to us what she does, and I'm so much excited. So kindly remember to watch this video. So guys, I have my friend here. Hi, how are you?
I'm very well. How are you?
I'm very good.
Happy holidays.
Thank you. Happy holidays.
Thanks for having me. I'm grateful.
Thank you.
Yeah.
Kindly introduce yourself to my viewers and tell us who you are and what you do. I've told them you do very well, especially issues to do with health.
My name is Robai Makungu. I'm a specialist in preventative or rather alternative therapies. I do lymphatic drainage. Lymphatic system being the system that purifies the body, and if your body is not purified well, that is where it accumulates dirt or toxins, and then that is where the diseases comes from.
Okay.
Yeah.
So basically that is what you do.
That is what I do, and I have a passion for people to get better and understand their body systems very well, because the body has a body language. Yes.
You know, you've used very hard words. You know, like me, I'm trying to struggle. For someone who needs to understand in a very simple term, what do you do? Yes.
Lymphatic drainage, it's a therapy where lymphatic system is a system in the body that purifies, or rather sieves dirt from the body. So sometimes what normally happens when the body fluids are going from up and down, they should feel finished like something like a circuit, right?
Okay.
When they're coming down, they're supposed to go up. So they're filtered in the armpits, in lymph nodes, and then they're supposed to be drained, filtered, and then the good ones remain in the body, the bad ones comes out. Yes, so sometimes when they're stagnant, that is where they start accumulating toxins. And any toxins that go, they go to a specific body part. When they stay there for a while, they bring diseases to those places. Like when they go to the chest, you get asthma. When you get it in the joints, then you're going to have arthritis problems. It is like that. If they get into the vital organs, then you have issues in the vital organ. So when they are drained properly, at least now you can get everything going. That is the nutrients, oxygen, body fluids, like that. Yeah.
Now, you know, we're doing this video and it's actually in holiday seasons, and guys are really out there feasting and all those things. And I know we need to take care of our bodies.
Yes.
Yeah. So why would someone just come for your services? Why would you recommend people to come for your services? I know people go to the doctors, and I know you work closely with them, but we are talking of a different area of treatment. Why would I come for the treatment for the same?
Coming for the treatment, I'll help you, teach you and make you understand how to listen to your body. As I said before, your body has a language, and you should understand your body language. You fail to understand your body language, that is when something steps in, you can't even feel it. Even if you're going to get the blood pressure, you can't feel it. And some of these issues, you find that you have bursts in the brain, or there is a vein that busted, and then, you know, it poisons the stomach, you know, and it brings issues. So one thing I normally recommend, just learn how to understand how your body works. When you learn to understand how your body works, it's going to tell you when to eat, when to sleep, when to relax, you know, when to do a workout. Yes.
Okay. Yeah. So I know people take a lot of different types of food. Are there some kinds of food that you'd want to recommend, or are you saying I should not eat this type of foods? How do I remain healthy so that my body can be able to function quite well?
You know, we are godly people. God provided every type of food in this world for us to eat. I wouldn't come and say that you do not eat this. unless you have an issue. We try to rectify it, but you reintroduce whatever you are eating. And then we see, does your body react to it? Because we have so many foods, we have so many exercises and therapies. So what I would recommend is, what does your body want? Because Ababu, it will talk. It will tell you, are you going to eat this kind of food? And it depends on what also you want. Do you want to lose weight? Because sometimes you find people walk, you've seen people walking day in, day out and never lose weight, right? They're doing in the right thing, but in the wrong body. You should understand, does this body want you to reduce on your food intake for it to lose weight? Or does it want you to eat to lose weight? Because sometimes you just need to eat for this body to lose weight.
Okay.
Yes.
Yeah, so I think I really feel like people need these lessons. Yeah. You've talked about listening to your body. How do I listen to my body? You know, sometimes I listen to other people, but how do I listen to my body?
Listening to your body is simple. I can ask a very simple question, right?
Yeah.
When you're taking something like food, leave alone soda.
Yeah.
Let's say food or water.
Yeah.
Do you normally feel it?
Yes, sometimes when I need to drink some, I'm thirsty.
Yeah.
Yeah, I take some water.
But do you get to taste it, the water? Because water has a taste.
You know the way we drink. Let me just.
Yeah.
You know the way we drink water, guys. You know, if this is water, most of the time the way we drink it, it just goes completely because I want to feel it.
Yeah.
Is that the way I'm supposed to take water?
No.
Okay.
No. So when you have your water, let's assume this is water, right?
Yeah.
When you have your water, you should taste your water. That is the first body language. Are you connecting with this water? So when you take water, you should taste it. First of all, kuna room temperature, it's cold, it's warm. Those things you're supposed. And then when you're taking your water, you sip, you stop. You sip, stop, wait for a while, and then you sip again. Not those ones of just gulping the whole thing up. And that's why I've had issues even with my client over and over again. They're like, we can't take water because we use the toilet so much. You use the toilet so much because you put everything inside the tummy all at once. So, and then it becomes too much and then it needs to come out. But now the problem with that one, you use a lot of electrolytes.
Okay.
Yes, but sipping again, it helps your body get the nutrients out of the water and just the supply of hydrating your body throughout.
Okay.
So when you're busy, when I'm busy, actually I do between 2 and 3 liters when I'm very busy. And I don't use the toilet much. And people that have tried this method, they can really testify. Even you too, right?
Thank you so much. So you can tell us, what are some of the services that you offer? Like you can just mention some of the services that you offer to the client so that whoever is interested to look for you, they'll be able to know that if I go to Daktari, these are the things that the services that I'm going to get, which is actually the alternative treatment. What are some of the services that you will offer?
My services are quite wide. It depends on what problem you're coming to see me for. So I do pre and postpartum care, post-surgical care. This one is whereby when you're due for a surgery, there are things we call just relaxing those muscles and just helping you, to go through the operation relaxed. And then also it helps also with recovery, circulation of oxygen, circulation of body fluids, which also helps in recovery after. I do pre and postpartum care. This is for pregnant women. It is also quite wide. We normally start even before conception because sometimes people, they have difficulty in conception. So again, these things we need to explain them in details. I think we need to do another video to explain each and every thing in detail. So those ones, they involve pregnancy, edema, swollen feet, right?
Okay.
When you can't sleep very well after delivery, we help you with milk production, help you with Kegel exercises. We are going to help you with uterus going back, you know, making sure you work your core muscles out, trying to get you back to the normal functioning level, because now we noticed many ladies are career women, so they want to give birth and go back to work. Breastfeeding, how can you, you know, what is it called? You can, how breast, because we have some ladies who don't know how to breastfeed. I help you also during labor, because I encourage also natural labor. So I help you through labor so that you can really understand. I didn't say it's not going to be painful. It will be painful, but are you going to manage it? How to breathe during labor and such like kind of things. And get your body back in shape. Yes, help you lose weight during breastfeeding. Because actually you can lose a lot of weight during breastfeeding. Yes. I've not finished. That is muscles and nerve pains, like muscle bulge, sciatica, like that, neck pains. You see those numbness, if you have tingly fingers. I do physio, weight loss journey if you want also. And then also in the elderly people, there is this service I do for them, because sometimes they are immobile most of the time. So we try to help them to get mobile. And what I normally do is help them, because again they can't breathe properly. Their breathing is a bit shallow, and they have swollen legs and also tingly in the fingers. I help with that one. Insomnia, if you have constipation, I deal with that. So it depends on what you're coming with. So we look at it in different ways.
So if I show up at your office, then I share with you my problem, you'll be able to know how do you approach it?
You know, sometimes sharing is not going to give me a full picture. Because I think people don't really express what their body feels like, because you've been in pain for so long until the nerve shuts that part of the organ off. So actually you might be in pain, but the body has shut off. So sometimes I tend, even if you tell me what you're feeling, I normally like going in and just walk you through that journey and try to understand what is really happening in this body deeper. We try to get the root cause of the problem.
Thank you so much. So I think we are getting to understand a lot about what you do, and I would want to encourage people to seek for your help, because there are many challenges, and we need to, especially for the new year, guys, we need to think about how we can take care of our health, and especially with the alternative therapies. And you know, someone may ask, which hospital is this? I mean, where do you classify yourself? When I come for treatment, where do you classify yourself?
We are not in hospital based, because we are therapy, we are preventative. The system in Kenya, they do curative. So those are two different things. If we went out there, you get into a hospital, you ask, are you going to do curative or preventative? So when you tell somebody you want preventative, that is where now I come in. We prevent these big diseases. Yes.
I think there's a Swahili saying that says, my Swahili is not good, guys. Wanasemanga namna gani? They say kuzuia ni, there's a saying that says, is there a saying like that, or I'm just...
There is.
It says what? Kuzuia ni better kuliko...
Kuzuia ni bora
kuliko kutibu.
Kuliko kutibu, kitu kama hiyo.
Yes. So they really make sure that wanazuia, they arrest the situation, and that's very much important. So Daktari, thank you so much.
You're welcome.
What is the name of your place where you work, or where can they get you? I know we had talked and you told me you're available. Sometimes you give services even at home and whenever people are. So, but where are you based if someone is to locate you?
We are called Health Fit. And we are along Kangundo Road, just opposite the mall, right? It's called Woodville. Opposite, there's a place there. Hapo kuna mbao. Ukiingilia hapo. But I like to have you on appointment. Because I don't work this side. I just thought maybe I could start these services here because I saw a need. I go to a church and I just look at the way people are seated. Even when I go like here in a restaurant, I can just sit and watch people just moving around, and I'm like, that one has issues. Yeah. So I saw a need,
Yes.
just to bring, because I have a passion. There is something that I feel like I fulfill when I see somebody, you know, better health-wise.
Okay.
Yes.
Guys, you know, she's just mentioned kitchen. Actually, we are here courtesy of Michelle Kitchen. It's actually based here in Joska. So you can always come in here and grab some cup of tea or even some fish and such kind of things. So it's a very nice place. I've showed you in my other videos. So you can always come in and be able to get services. This is in Joska. Yeah. So I'll share your contacts so that people can be able to call you. And you've said that
nice.
it would be very important for them to book for appointments.
They book appointment because I don't work here. I do house calls because some of my clients they're unable to walk because I work with paralysis, Parkinson. It is very wide. Don't cut yourself out. If you're unwell, you're feeling like you need help, I'm here.
Yes.
Let's help you get this body to the normal functioning level.
Yes.
And my sessions, the good thing about it, once you finish the session that I give you, we are done.
Yes.
So long as your body picks a signal, we are done. If I give you an everyday session, just know you're battling off.
Okay, thank you so much. So guys, I think we have gotten to learn a lot. And remember, Moving Wheel Channels is about informing you, getting to let you know some of the places where you can get good services, and we're just taking care of ourselves so that we can be able to be healthy, getting to see new places and so please, let's get in touch with Daktari. I'm going to put the contacts there, and then we'll be able to get more services of the same. And hopefully we'll continue doing these videos. We can actually do a video when he's attending to one of the patients, one of the clients that she serves, and I'll keep on showing you more and more. And possibly, what is your parting shot? What is the last thing you'd want to say as we complete this video?
Parting shot. Even as you go to the season of Christmas, do not be afraid, because sometimes these bodies, they crave. Even me, I crave for pizza, but I know it's not good for me.
Yes.
Enjoy, but let's see you in January.
You know, guys, when we came here, we took some tea, and okay, tea is good. Not tea, sugar.
Yeah.
But I remember when I was trying to put the cups, I looked at Daktari whether she's looking at me.
Yeah.
And I noticed she was not bothered so much with it. So some days it's good to indulge, especially during this season.
Yeah.
Yeah, but please also be very careful that you need to take care of your body. It's very much important. So guys, thank you so much for coming in. I wish you happy holidays. Please remember to subscribe, share and like. We are having, I've aligned a lot of activities for the new year. So please keep on checking and stay locked. Cheers.
Bye.
Bye-bye.
Bye.